And speaking of whom, Dr. Michael Baden right now with us, forensic pathologist. He's on the phone. Doctor, how much do they know but they can't say? In other words, as a pathologist, and you're there and they've conducted an exhaustive 4-hour autopsy. Are there some things they can rule in and out they're just not sharing right now?
Neil, absolutely. And as was said in the press conference, nothing is going to be released from the medical examiner's office. It's all going to be released by the sheriff. They said that at the press conference, and that's why the medical examiner knows a lot of stuff. They know if he had any natural disease that could have caused or contributed to his death. If he had pneumonia, if he had heart disease, if he had a brain hemorrhage or pulmonary embolism, they know that right away.
Would they know, doctor, any signs of foul play right away?
They would know if he had any injuries, any trauma, any injury to his neck, if he had been choked, if he had been hit in the head with something, or if he fallen and injured himself. All that would be known. The one thing they don't know is the toxicology. Now, the toxicology is going to be done within 2 days or 3 working days. They'll know whether he had a lot of oxycodone, what's in Percocet. Whether the sheriff is going to allow it to be released or not is something else. The 2 weeks sounds like the usual police or district attorney statement that they need time to do whatever they're going to do before the public knows about the actual cause of death.
When you hear something like this, we try to connect things like his last being seen around 8 p.m., I guess, when he was getting dropped back off at his compound. What are the kind of things you look for when you investigate, and you've been on some of the most high-profile cases imaginable? Whether he's out of breath, whether he's tired, whether he's staggering, what kind of things do you try to piece together? Because only hours later, he's found dead in an elevator in that building.
Yeah, well, it's interesting because they do have him walking around, pacing nervously, appears outside the Walgreens.
Right.
Now, if it's true, what the history is that what Harvey Levin has said he found, that he's been taking Percocet since 2010, then he's addicted to Percocet. After a few weeks, oxycodone is the active ingredient together with Tylenol in Percocet. And oxycodone is the prescription opioid that causes the most deaths in this country. It's the most widely used. OxyContin, oxycodone, Percocet are all have this very strong narcotic drug, stronger than morphine. So what Harvey Levin is saying makes sense, but of course we don't know it until the toxicology reports are released, which could be in 3 days or could be in 3 weeks or 3 months, depending on what the sheriff wants to do with it.
You know, Doctor, we do know that he was in great physical pain. He had hip and joint pain. You wouldn't know it in some recent concerts.
Right.
So in Atlanta, when he was there, that was largely a sitting down concert at his piano. He limited his movement. Some people maybe overinterpreted that, overanalyzed that. I don't know. But do you ever, or do you get a sense that Percocet alone, if you get dependent on it, unless you start overdosing on it, that doesn't get to be the issue? The issue might be if you take it with something else, what?
Well, the Percocet you could just take with water, you know, the pills that you take with water. And the active ingredient for people who have 2 active ingredients. One is the acetaminophen, which is Tylenol, which is okay, and the other thing is the oxycodone, which is much stronger painkiller, but is also addicting. And it also, see, the story about an emergency landing going down into the emergency room from the jet would go along with the fact that he was having an overdose. You don't have emergency landings for pneumonia. Once he gets the Narcan, which is the antidote, he feels fine. But he's supposed to stay there and get further evaluation, further medical treatment, and he didn't. He left, presumably against medical advice. And that's the problem with these things, Neil. You saw it with Elvis Presley. You saw it with John Belushi. When they're using Elvis Presley was mainly prescription drugs like Percocet is, where the handlers, the people around him, the entourage around him, tries to protect the star from people from the public knowing about any drug difficulties he has, but they also prevent treatment. He should have stayed in that emergency room after an overdose, if it was an overdose. Now, see, we're being speculative here.
No, you're absolutely right. And by the way, the argument that he didn't was because he couldn't get a private room, whereas people said, we're out of here. We don't know what's true. But, Doctor, I did want to ask real quickly, with time for time, there is this notion that those who rely on Percocet for pain, there's a diminished return that you keep taking the same dose, that in order to get more of the pain fulfillment, you take more.
Yeah, you're absolutely right. That's because one gets up a resistance to the drug.
Right.
So one of the characteristics of a narcotic drug is to need more and more to get the same result.
And then if it was found, he was found in an elevator on the first floor, presumably collapsed. How would that manifest itself in the end?
Well, it would manifest itself with a lot of fluid in the lungs, and with very high level of Percocet in the toxicology. And that's the medical examiner knows whether there was a lot of fluid in the lungs is what drug overdoses cause. And they'll have to wait till they find out how much narcotic, if there is a narcotic, how high it was, so they can then evaluate what the cause of death is.
Real quickly as well, he had epilepsy years ago. He was not taking anything, we're told, for that. Does epilepsy just go away that way? I mean, it would obviously still be with him.
It depends on the cause of it. Sometimes epilepsy is due to certain immediate things going on in the brain, and they can outgrow it. And some people have it all their lives. But you don't go down an airplane for epilepsy. You know, if you have epilepsy,
right,
you recover from it. With proper treatment, with just handling at the scene, it'll go away. It's rarely a cause of sudden death. So that's one of the things they're looking for, to see if he has any kind of brain damage. If he has some brain damage, that could be a cause of epilepsy that persists all during life. But oxycodone is not, Percocet is not a treatment for epilepsy.
All right, so the fact that they ruled out suicide, they seem to rule out, though not officially, any foul play, any signs of trauma. So hearing what you're hearing, they're just isolating things for the time being as they go throughout the tests and the results of this 4-hour autopsy.
Yeah, they've eliminated, depending on the findings, they may have eliminated natural disease because there was an issue of whether he was having severe pneumonia.
Right, right.
And they know that whether it was true or not now.
All right. And
it's just a matter of eliminating all other causes of death, as you say, Neil.
Doctor, thank you very, very much.
Sad situation, and they'll know the answer shortly.
Dr. Michael Baden, forensic pathologist, so many cases he's been integrally involved in.